Hey there and welcome. It is good to have you with me today. Today we are talking about sclerology as a part of an iridology assessment. So I'm going to invite you, especially if you watch this as a replay, to when you get that, to watch it and to click a like, to drop a comment, to subscribe to the channel, even share the video with a friend. It helps to make the videos more visible to more people. And it does help my account. And I really appreciate your help with that. Love it if you would take a minute and find that chat box and say hello so that we know how to use that. I love it when my attendees take a moment and ask questions and interact, right? I like my training to be interactive. Jack is here. Yay. Jack is a course grad. Good to have you with us. She's a certified iridologist. Any of you who are in or near South Dakota and you're looking for an iris assessment, Jack is your girl. Glad you're here, Jack. Lori's here with us. She's a student. Yay, Lori, good to have you here. We've got lots of other familiar names and some new names too. So it's good to have you with us today. If you're looking for a way to assess your client's health so you can create more effective programs for them without spending more time, because neither you nor your client wants the assessment and recommendation to process days or hours or weeks, right? Then you want to get into using iridology and you want to use it with sclerology. The way I teach iridology, I teach you how to do your iris assessment and your program creation right in your client session. This is a good thing because it means that you can give your client information while they're ready for it, not a week later when you finally have the protocol written up. So we're going to dive right into this. We're going to learn a little bit about sclerology. We're going to look at a whole bunch of stuff. And towards the very end, we're going to do a complete iris assessment that includes the relevant sclerology. So you can see how the iridology and the sclerology mesh and how it would work in a clinical setting. So important. All right, and do feel free to drop questions and comments in that chat box as we're going. And if I can possibly work the answers into the presentation, I will. Both iridology and sclerology are assessment tools. They are not diagnostic tools. So diagnosis means you're naming a disease. Medical personnel are the only ones who are allowed to do that. If you're a holistic practitioner like I am, you don't get to name diseases. That doesn't mean we can't help our clients. We know that the iris shows us genetic potentials. So it shows us where the inherent strengths and weaknesses are. And it shows us how the organs want to work together. It shows us if they want to play nicely with each other or if they want to sling mud at each other. And now when we add the sclera, it shows us where is the active hotspot? Where are the areas that need love now? And if you haven't done iridology with the client before, that may be a long-standing problem for that client, and you are just now seeing it because you're just now learning sclerology. Now, it might sound like the sclera, because they show us where the problems are now, might give us enough information with which to create a program. But the sclera alone don't help us to see the order in which problems should be addressed for the best results. And for that, we really need the iris, right? We need to see the iris to understand, and we need the client's symptoms. We need to know what the client's symptoms are to understand then, as we put it all together, the order in which things should be addressed and the most effective way to address them. We always want to have at least two, preferably more, indicators teaching us about a potential problem, because each indicator adds a layer of depth to our understanding. And the more depth we have, the more we can actually focus in and laser in on what should be happening here, what we need to do. So we want to be able to use sclerology and iridology both. And certainly it takes more than a little mini class like this to learn sclerology, that's for sure. But today we're going to look at some real life applications. We're going to learn a couple of sclera markings, and hopefully you've got enough anatomy and physiology under your belt that this will make sense for you. When we dovetail iridology for its genetic information and sclerology for the where things are happening right now information, we do get that very clear picture of what we need to be working on. Client symptoms, genetic predisposition, what's happening now, Here's the questions you want to ask, and here's the things we want to be working with. So here's the thing. When we're learning this, we want to learn this in an effective way, right? You want to learn it with a teacher who will mentor you and coach you and give you immediate feedback and help you to build the knowledge and build the understanding of the tool. Does that make sense? That you're not really going to learn sclerology well from a textbook? If that makes sense, give me a makes sense in the comments box. A textbook cannot teach you all of the nuances. Okay, and so today we're going to look at sclerology, but we will at the end integrate it with iridology so that you can work with that. And Graham is saying it makes sense. Thank you for that, Graham. Really appreciate that. So again, you really want to have that A and P under your belt, that anatomy and physiology that will help you in ways that will just blow your mind. Without that, you're going to be lost a lot. When we do an assessment, we look at the iris, right? This is giving us the genetic potentials of the body. We look at the pupil. The size and shape of the pupil gives us more information, some of which is genetic, some of which is situational. And we look at the sclera, or the white of the eye, right? And that's what we're talking about today. When we layer all of these together, we get a really great snapshot of where we're at and where we need to go and what it takes to get there. The pupils give us some unique information. And again, we're not going to dive into that at all today because that's an entire lesson in the dynamic iridology program. So for the sclera, here's what you already know about the sclera. You know that the sclera is very reactive. If you've ever had a really ugly cry, right? You've been somewhere and something really upset you and you had that really ugly cry and you went into the washroom and you splashed cool water on your face. You know, you look at your face first and your eyes are really bloodshot. So you throw the cold water on your face, give yourself a few minutes and things calm down. And so you know that the sclera is very reactive. Okay, they tell the story of what your body's doing right now. In the Dynamic Iridology Assessment System program, we learn 12 of the most important sclera markers. We learn what they teach us about the client's current health challenges and how to assess them in connection with the iris markers. Today, we're going to learn 3 sclera markers at a very high level. Thank you, Jack. She said in the comments, you are so good at teaching this that we can make our own assessments. Yes, thank you. That's exactly the reason I teach, is so that my students can use this. So appreciated your classes, she says. Thank you. Really appreciate that. Let's start with one that's pretty easy. And if you've got a medical background of any sort, you will recognize this one. This is called jaundice. And it's when the white of the eye has that yellow cast to it. Now, depending on your device that you're watching this on, you may or may not see that yellow clearly. I've got here, I'm sitting here, I've got 3 computer monitors, 2 connected to one computer and a laptop. They each show color differently. And so on the monitor I'm working on right now, I see quite a heavy yellow. There's some gray in here as well, but I see heavy yellow in here, and this is jaundice. And so this tells us, and this is a medical definition. This tells us that the liver is not conjugating bilirubin properly, and the bilirubin levels are building in the body, and that will show in the whites of the eyes and in the overall skin tones as well. So this suggests that there is a liver imbalance, a liver enzyme imbalance happening right now. That could be a part of a bigger problem, or it could be a part of a chronic situation. So if you see jaundice, you need to ask questions to find out what your client knows about their own liver health. Have they ever been diagnosed with something that would cause this symptom? Is it a benign situation that you could support easily with nutrition or herbs or lifestyle, or is it potentially more serious? This can be a very serious situation depending on what's causing it. And this is, again, why you need your college level anatomy and physiology course before you learn iridology and sclerology. We need that A and P to understand what could be going on in the body. Now, in this eye as well, we can see, and we're going to just throw in a little bit of some iridology here. Right here, we've got an interesting little fiber that's kind of jogging around. This is in the liver reaction field. So we know that this person inherently might have a predisposition towards something in the liver not behaving itself. So when we see this and the yellow, then we know we want to have that conversation, right? We don't get to diagnose and say you are jaundiced, but we can say, you know, the whites of your eyes look a little bit yellow. You've got this little marking in your eye that suggests the liver might have wanted to be cranky all along. What do you know about your liver, right? And so Lori is asking, can jaundice be seen in the hands and the feet and face, but not show up in the eyes? It will show up in the eyes as well as hands, feet, and face. Okay, it's not going to skip the eyes and hit only hands, feet, and face. The eyes are probably the easiest place to see jaundice. So the story behind this exact picture is this is an older fellow in his late 60s. He doesn't drink alcohol. He does take supplements. He is not on any medications, but he's worked in a lot of chemically toxic environments. So that could have stressed his liver. We know that genetically his liver is prone to being a little inefficient, but all of that exposure to all of those chemicals without the proper respiratory and protective gear, because they didn't do that when he was younger, right? Those are safety features and safety requirements that have come in as he got older, but all of that toxicity hitting his liver could have upset his liver in some way. Remember, everything you breathe, ingest, touch, ultimately goes through your liver. So you can't say, well, I never drank alcohol, so I wouldn't have liver problems if you worked in furniture refinishing and didn't use a respirator and protective gear, right? Does that make sense that everything goes through the liver at some level? So while working in those environments is not going to change this structure in his iris, it certainly can compromise liver function and burden his liver and compromise how well his liver can conjugate the bilirubin, and that can lead to issues. So if his concern as he came in was that he had noticed his eyeballs were becoming yellow, then we can give some dietary advice. We could suggest spending some time in the sunshine. We know that sunshine without sunscreen helps the body to conjugate bilirubin more effectively. We would also suggest that he go to see his doctor and get some lab work done, right? That is a legal requirement on my end with the work that I do because I can't requisition labs. But I would say to him, if he didn't know he had liver issues, if he couldn't already tell me, yeah, I've known that for a while, I would say, you know, I have to tell you, you should get some lab work done. So I would suggest talk to your doctor, have your doctor look at the whites of your eyes. If the doctor also agrees that they are yellow, the doctor may want to do some lab work, and I would support you in doing that. And then I would say, I want to see the lab tests when they come back. Okay, so we can do some things like that, get them out in the sunshine, get them drinking good purified water. Until the medical tests are back, we again need to encourage him to drink good pure water. We need to encourage him to get some sunshine because that will all help. We also need to encourage him to get adequate sleep and to not skip meals, because depending on what's going on in his liver, skipping meals can make jaundice worse. It can really stress the liver. Cut sugar. Sugar's not quite as important for this one, but you know, I'm always going to end up going there, right? Now that gray clouding that we see on the medial aspect of his sclera is another sclera sign that we're not going to dive into today. But certainly it does suggest some things that we would need to talk about with him to find out if there were any other health problems that he knew that he had a history of, right? This is a man who's 70 years of age, and this is his left eye. And again, we are looking at the sclera. We've got the whole eye here, and we are looking at the medial aspect of the sclera, so the part of the sclera closest to his nose. He for a long time has been an oil patch consultant, but at his age, he is now semi-retired. He has a little hobby farm and he does all of his farming by hand. Like he doesn't use tractors for anything. He'll throw the bales onto the back of his pickup truck to take those out to feed the horses, right? So he does it all by hand. Very fit, very lean. He mucks out the stalls by himself and it's just him. He has no hired hands to help him. So when he came in, I had met him at a Kiwanis Club meeting, and he was on my email list. I got a new iridology camera, and I sent it out to all of everybody on my Calgary iridology email list, and I said, "Hey, got a new camera. If you will come in and give me 30 minutes of your time, I will give you a 30-minute assessment, iris photos, and 3 markings and 3 recommendations in exchange for your permission to use your photos in teaching situations." And he thought that would be fun, so he came in. He really didn't have any health issues. He was just a curiosity seeker, and I'm perfectly good with that. He's a nice enough guy, not a problem there. So when I look at his sclera and we look at his pupil, and his pupil's not round either, we start checking things out and we see all of these vessels that are meandering, just like a little creek through some farmland, right? They are meandering. These do suggest that he may be setting up some circulatory congestion. He's over 70 years old. It would be highly likely that that would happen. So our conversation needs to be around the history. Is there a personal or family history of any kind of a circulatory issue in any organ? What is your diet like? What do you eat? What do you drink? What do you do for relaxation? Well, I know what he does for relaxation. He works on his farm, but he also has a lot of buddies from the Kiwanis Club, and they do drink a lot together. They get together to drink. And what is your lifestyle like? Well, he's pretty active. I mean, you're throwing these big hay bales all over the place. He's pretty active. So we need that background for context, because while many indicators have their own meaning, they also modify each other. So if we look at the marking by itself, it can mean one thing, but when we see it with other markings, suddenly that meaning can shift. So not having that basic context means that we're only going to be able to do one marking as one problem. Real basic, real cookie cutter. Anybody can do this, and it's not the very best way to do iridology. But understanding the context lets us go so much deeper and helps us to create that individual analysis and set of recommendations. So in spite of the fact that he is lean, he is fit, and he's very active, his sclerae show a lot of circulatory system markers. We've got a lot of suggestions here that are telling us that specific organs are headed into trouble with the circulation. We don't know how long this has been here. If this has been there for 10 years, then we know those organs are really headed for trouble. If we had seen them for the first time last year and none of this was there, but now it's all there, then we know this has happened recently. It's fresh news, right? It's new problems. So again, despite his apparent robust health, this is a fellow who drinks a lot of alcohol, several servings every day. So I want you to think this through. If meanders suggest circulatory congestion, what causes congestion in the circulatory system? What are your ideas? What are some reasons that circulation will not move well? If we've got someone who's lean, who appears to be fit, he's very strong, what would be some things that you might think? So varicose veins are a symptom. Hemorrhoids are a symptom. Blood pressure could be a problem. Diet could be a problem. Smoking could be a problem. Let's go even more fundamental than that. Sedentary lifestyle could be a problem. Yeah. Could it be that his blood vessels are constricted? Could it be that he's got plaque building up in his arteries? I mean, there could be a lot of things going on here, right? And so because of his alcohol consumption, I would want him to get some labs from his doctor, because his iris suggests that there are inherent risks with his cardiovascular, lipids, and cholesterol and triglycerides. right? Looks like he's trying to build some blockages with what we see here. And his sclera suggests that he's moving toward that. So we're seeing two indicators that say he could be struggling with his circulation and he doesn't even know it yet. He might just think that he gets a little bit breathless or that his arms and legs ache when he works too hard. And he might just be thinking, it's just because I'm getting to be an old fart, right? And that could be, but not highly likely. It's more likely that something else is going on. So if he goes to his doctor and gets those tests, then while we're waiting for him to get the test done, we could, and that can take, I don't know what it's like where you're at, but here to get a doctor's appointment, it's typically a 3-week wait. Then you have to book an appointment for the lab, which is again, another 2 to 3 weeks. So you're looking at 4 to 6 weeks, but we could start implementing things today with what we see here while we're waiting for his labs to come in. So again, the problem here is that he looks lean and toned. You might not think by looking at him that he could be at risk for cardio issues or blood sugar issues, but his eyes are telling a very different story, right? When we put the iris and the sclera together, we see a very different story. And so now what we want to do is we want to be working with his diet and his lifestyle. You know, the hard sell for him was I suggested you need to cut back on your alcohol consumption. And that was a hard no. It was like, absolutely not doing that. I like my buddies. I like my drinking. I'm keeping doing this. And so it was like, okay, well, can you get rid of the coffee? Well, I could reduce it. Okay, that's better than nothing. We'll take a reduction. Can you eat a large serving of leafy greens every day? Yeah, I could do more of that. So you know, there's some things that we could push him towards. Will they have a lot of an effect? I don't know. So I like what Jack says here, that what we're seeing in the eyes is a reflection of what's going on inside his body, particularly with the sclera. And she says, I was just going to ask about coffee, LOL. Very funny. All of my students know how I feel about coffee as far as health goes. This is a woman in her mid-30s. She came in to see me. She wanted help with allergies and depression. Now, the big challenge here is that both of those problems can have many physiological root causes, right? It's not as simple as you have depression, here's the answer. You have allergies, here's the one answer. So her eyes are lymphatic, which means they have that blue base. And she's got a lot of colors on top of that. We've got yellows and oranges and rusty browns. Right? So she's got a lot of colors. She's also got these yellow blobs, which you can see here, and a bit of a blob here and a blob here. And Jack is saying, I spotted pinguecula. Absolutely, you do, Jack. Well done. I like it when my students show off. It makes me look good as a teacher. It suggests when we see these things, these pinguecula, they suggest that she has issues processing proteins and fats and calcium. And in this case, it's the liver that's not processing them well. Again, if you know your anatomy and physiology and you understand how the liver functions, then you will understand that the liver has an awful lot to do with allergies. And it also, according to traditional Chinese medicine, has an awful lot to do with depression. Pinguecula can be surgically removed, but there's a very high risk that they will grow back. So it's interesting that these irides show some strong predispositions toward liver, right? And like I said, in TCM, the liver is where the depression comes from. So we've got iris markers and sclera markers all pointing to the liver, right? And so we're going to recommend some liver work, some diet, some herbs, some lifestyle, maybe some emotional work, if you've got the training to do that. And I would do a little bit of each. So this client, I would probably start with one dietary change. I would probably get her to include more leafy greens. On a herbal level, I might recommend a liver formula from one of my favorite herbal companies. Now, she's physically active. So one of the challenges, and at the time that I saw her, she was living with her mother. She'd moved out of her own place, left her own place empty, to go live with her mother, who was in the early stages of dementia, and the mother was not in a situation to be moved into a care facility yet. So she had a lot of stress going on with leaving her own home, struggling with depression and allergies, and living with her mom, not in this woman's own home. So, I would do on the physical activity, she's a personal trainer. So I would encourage her to get more rest, right? To make sure she's getting enough rest. And I would add an aromatherapy or a flower essence formula and to work on the emotions, and suggest that she seek professional help, particularly from the aspect of the depression and how living with her mother in a very difficult situation could be augmenting that depression, right? That's a very niche kind of a thing that would need to be addressed. The iridology and the sclerology work together to help us understand what the imbalance is and how to work with it. It takes training and practice and feedback and mentoring to get to where you can do this at a clinical level. And that's exactly why I teach what I teach. Graham asked, does clear yellow suggest gallbladder and darker yellow liver? I've never heard that the clear yellow suggests gallbladder. I have the yellows always suggest liver. Remember that gallbladder is an auxiliary organ to the liver, right? And so if the gallbladder's not working, maybe it's not working of its own volition, but it might be being influenced by the liver. And certainly if the liver's not working, that's going to have an impact on the gallbladder, right? Jack says gallbladder is often orangey or fluorescent orange pigments in the iris, So if we're talking about iris, we're talking about different colors, like your browns and your oranges for the iris, but for the sclera, we're talking about yellow, all right? The encapsulation. So when we see a blood vessel that looks like a little fish hook or candy cane, like this, it suggests that there may be an infection or a pocket of toxins in the body that the body is trying to sequester until it can find a better way to deal with it. Sometimes that fish hook closes off completely, so it looks like a letter P or, a Q, depending on which way you're doing it, or letter B. It's got the round part closed off with the other blood vessel up the back of it. And each of these, again, gives us slightly different information. If it's an open encapsulation or a closed encapsulation, it gives us slightly different information. Now, the pockets of toxins or infection might be so small that the client might not actually even be aware of the problem. They can be as obvious as an actual swollen gland or a cyst or an abscess. So the fish hook we see here, right there, suggests a history. No, sorry, right here, this little teeny closed one suggests a history of a kidney infection that might not be entirely resolved. So again, we need to ask questions. We need to ask questions and find out what the client knows. Shona is saying, I got that hook after COVID. There you go. I wonder what's lurking in your body. And I'm not saying it's there. I'm just saying I wonder, right? So when we see these, we need to ask questions about health history to understand what's going on. Only then can we actually make appropriate recommendations. Remember, we never diagnose. Depending on what other training you've got, however, you might be able to requisition lab tests. Maybe you're a naturopath that has the ability to requisition functional labs. That would be cool. Or maybe you're a nurse practitioner. If you are a herbalist or a nutrition coach, you may not be able to requisition labs. You might be needing to suggest that your client go back to their doctor to get those labs requisitioned. Can you see how understanding this marking fully and knowing what its placement means as an indication of where the problem resides in the body gives you the upper hand in knowing how to clear the problem out? And if you know that we've got the risk of this person holding on to some kind of infection or toxin in the kidney area, and this person says, oh my goodness, yes, I had a kidney infection 6 months ago or a year ago or 6 years ago, you know that infection is not fully resolved. So if you've got your herbal training, or if you've got nutrition training, or if you've got some other training where you can say, this suggests that the kidney still might have a little bit of a problem from that infection. I wouldn't go so far as to tell the client your body is holding on to that infection, because that sounds like a diagnosis, right? But I would say it looks like the kidneys might be having a bit of a problem. They might be still struggling from that infection, even though it was a long time ago. How do you feel about us doing some really good kidney support? We could get in there and do some things to help the kidneys fight off that infection, get rid of it, offload it, and get the progress we need, right? Because I mean, kidneys, there's something not working right in there. You could be looking at blood pressure, kidney stones, fluid retention, electrolyte imbalances. You can look at lots of different kinds of fallout that can happen if the kidneys aren't working well. So getting in there to support it could be a good idea. So we always want to lean on whatever other modalities we have to create the protocols we need based on what we're seeing in the eyes and based on what our clients are teaching us. Because our clients teach us, we ask them questions, they give us answers, and it teaches us, right? So important, so important. We've got some more eyes to look at here in a minute. Just wanted to share some of what some of my students have said. We've heard a little bit from Jack here. So glad she's here. Angela Hodges says, what a fantastic course with a fantastic teacher, actually cares about your success. I'm so happy I found her. I am a registered dental hygienist, have been for 20 years, but have been studying naturopathic and homeopathic modalities on the side to help my own family. Now I want to open up my own business using iridology to help others be healthier. I've already signed up with Judith for her next class, so I can brush up on the body systems and learn herbology along with it. So I teach dynamic iridology, and for the students who graduate from that course, whether they've certified with IPA or not, they are then eligible to take other courses that I have created that incorporate iridology. And so that's what Angela's talking about with next class. She was looking for the next one that was coming up. Those of you who are new to me, I'll do a little introduction now, a little bit later than usual, but I am Judith Cobb. Hi. And I am one of 9 level 3 certified iridologists and iridology instructors in the world. IPA has very rigorous standards for certifying their iridologists and the instructors who can teach their curriculum. And I'm very pleased that I am one of only 9 who has certified so far at the level 3. IPA gives us new badges every 2 years when we've submitted our upgrades, and they've just started issuing badges. But I've been a certified iridologist for decades. I've been in the wellness industry practicing iridology, herbology, and nutrition since 1981. You do the math. I've studied iridology under 8 different teachers, 3 different styles, and that is what I've built my practice and my teaching on. I've designed and taught so many courses over the years. Jack says, I've taken numerous courses in the healthcare field, and Judith is one of the best teachers I've ever had. Jack, thank you so much. I'll pay you for that later. I don't pay my students. They're just so sweet. And I really appreciate that they love what I teach them and how I teach it. I've taught prenatal. I've been a certified prenatal educator, so I've taught those kinds of classes. I've taught biokinesiology and color therapy, different kinds of herbology, iridology, women's health, all kinds of things, and it's just what I love doing. I'm also a master herbalist and a nutrition professional associated with these 2 nutrition organizations and this herbal association. What I love about all of these groups, IPA, CanP, CanPro, and the AHA, is that we have to submit CEUs. Like, we have to prove that we are staying up on our studies and that we are up to date. So I really appreciate that they hold my feet to the fire to help me stay up to date and to help me be better at what I do, both in teaching and in clinical work. Here's another client. We've got a couple more cases to do here. This is Nick Jennings. He's 79 years of age. He came to me wanting to lose weight. He had excess abdominal weight. And the problem with him is that his weight was affecting his knees, and it was meaning that he couldn't walk. He had a lot of pain. He had prostate cancer that had been treated with radiation and hormones. He had a doctor's diagnosis of congestive heart failure. He had an irregular heartbeat, shortness of breath, and reflux with heartburn. When he came to see me, he was on 8 different medications, including an anti-anxiety medication to help him stay relaxed when he couldn't catch his breath. He also had a hiatal hernia, and it was not diagnosed by the doctor, but I sent him to an osteopath to get it assessed, and the osteopath agreed. I said, I didn't say you have a hiatal hernia. I said, I'd like you to go see this osteopath and have the osteopath assess you to see if you have a hiatal hernia. I never said he had it. The osteopath did. So, the weight gain at his age with all these other issues, the questions in my head are you insulin resistant, and do you have excess uric acid? That's what's circling in my head as I'm looking at his eyes and as I'm talking with him. Now, you'll notice he's got gray patches here. Again, we're not going to talk about the gray patches. He's got the pinguecula. It's not quite yellow, but it's right there. So we know liver, carbs kind of things. We've got these little cloudy bits and purple dot things at the ends of these blood vessels, which says not processing carbohydrates properly, which usually means either candida or blood sugar imbalance, or it's a carbohydrate issue, regardless of how we look at it. He also has a corneal arcus, actually moving towards being a corneal annulus, which suggests, again, liver not handling carbs very well. We've got a pigment right here, which is sitting in the liver pancreas zone, which tells us that, liver pancreas genetically don't want to be very happy, or sorry, that's a liver color sitting in the liver zone. My apologies there. We've got a little bit of dirty yellow in the eyes, which again tells us that he may not be handling uric acid very well and getting rid of it. And interesting, elevated uric acid is a key player in insulin resistance and cardiovascular issues. Okay, so he brought in some lab tests. His hemoglobin A1C was 7.7. We want it under 5.7. So he was definitely where the doctor would have said pre-diabetic or insulin resistant, or even type 2. He had low leukocytes. His lymphocytes were very low normal. His hematocrit was very low normal. His erythrocytes were low. His testosterone was very low. He'd had prostate cancer. He was being treated with estrogen. So that's why his testosterone was low. And he had elevated triglycerides. None of that was a surprise. Again, we suspected hiatal hernia, but I needed him to go and see an osteopath to get that assessed, because a medical doctor is not going to assess that very accurately. We suggested that he should be using berberine IR for the insulin resistance to help his body use those sugars more effectively to be not insulin resistant. And we did glucosamine for his joints and his gut health. Did you know glucosamine is brilliant for rebuilding the intestinal lining? And we got him on omega-3. Now, his diet was pretty scary. He thought he was doing a great job, but it was not great. He was trying to eat low fat when really he should have been eating low carb. So his breakfast was rice cakes with marmalade. Lunch was typically a rice cake with more marmalade, and supper was a protein and some veggies, right? So we had to clean up his breakfast. I got him to start doing sauteed vegetables with a couple of eggs. At first, when I suggested that, he looked at me and it was like, are you crazy? Are you absolutely crazy? Nobody eats sauteed vegetables at breakfast. I said, does that mean you can't? I said, try it. Give it a test for a week or two and let me know what happens. I got an email from him after about a week saying, if anyone had ever told me I would enjoy eating vegetables for breakfast, I would have told them they were crazy. Oh yeah, I did tell you you were crazy, but you know what? I really like this. And it was like, very cool, very cool. We got him to add more vegetables to his evening meal, and we got him to walk 30 minutes a day. Now, remember, his knees weren't happy. So I said, you know what? 30 minutes can happen as 5 minutes 6 times over. And so that's what he did. He would go for a little 5-minute walk, and he was doing that 6 times a day. I suggested sleeping on a wedge pillow because he also had some sleep apnea going on. And he actually, after about the first 4 weeks, when I saw him for his follow-up, his first follow-up, he looked at me and he was beaming. And he said, guess what? And I said, I'm fresh out of guesses. Just help me out here, will you? He said, I can walk for 30 minutes nonstop and my knees don't hurt anymore. Oh, is that because we've started to clean up the diet? I wonder. And he said, you know that wedge pillow? I sleep like a baby on that. I'm sleeping better than I've slept in years. So good. And he was losing inches. We didn't do anything hugely dramatic. We met many more times and continued using his eyes and refining his nutrition and his supplements to get him to where we wanted him. But we certainly, I mean, he was getting results so quickly and he was so good at following instructions. Jack, yes, you do see fermentation signs in there. So why would you want to learn iridology the way I teach it? I'm teaching constitutional iridology. I call my take on it dynamic iridology. You'd want to do this because I teach you how to do your assessments spot on, laser focused, so you can do a fast assessment. So you can be more accurate in your assessment. Sometimes when we learn iridology, what we learn is to look for every little mark, and then we get this shotgun pattern. And it's too broad, it's too much, and it doesn't help the client. So when I teach iridology, I teach you how to see the markers that relate to what your client wants help with and understand what those markers mean. What questions do they want you to ask so that you can create your protocol? And you can get, when you do it the way I teach you, you can get to where you're doing your intake, your assessment, and your protocol creation in an hour or less, right? So good, so good. And it means you're not overwhelming your client. Better and faster rapport, that's a good one. And it eliminates the need for an intake form. You still will always need a signed release form. You know, the one that says, I know that this practitioner is not a medical doctor, cannot diagnose, cannot prescribe, blah, does not replace my medical doctor, blah, 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 all that kind of stuff. You need that. But the lengthy questionnaires, just chuck them. They ask so many questions that go in so many different directions that it doesn't help you to laser focus on what you need to be able to do with your client, right? So important. Again, most iridology programs actually only teach you the markings. They don't teach you correlating iris to sclera. They don't teach you how to think through the eye, you know, what markers go together, what kind of information do they give you, how do they mesh. Most programs don't teach you that. They just teach you markings. I absolutely teach the practical application. That's why my course is longer than most IPA teachers. And that's why I offer a lot more support for my students outside of the actual classes as well. Karen Cho, one of my very first certified grads, one of my first IPA certified grads, said this: I just returned from a regenerative detox course where iridology is implemented. I spread the word about what a wonderful teacher you were. Most people I talked with did not have anywhere near the same experience with their iridology education. They had no support, unanswered questions, and a lot of confusion. Mostly they finished their classes not knowing how to implement what they had learned. I feel so absolutely blessed to have been taught by you. I feel totally supported even still, as I've graduated almost 6 years ago now. And so I just really appreciate that. She's a CNHP and she specializes in gut health. Another student, Kimberly Zadalis. If you're wondering which iridology course to take, you can stop looking. You found it. Judith Cobb is an excellent instructor with many years of experience. She is a caring and compassionate person who is dedicated to the field of iridology and her students. I personally practice both Eastern and Western physiology medicine. Kimberly has a master's degree in radiology, and she works as a radiology. It's more than a technician. She does a whole lot more with the images she gets. But she also has her own clinic where she works with Eastern medicine. And she says, I was very impressed with the layout of her program. She makes it easy for students to balance work, life, and study. Really love that. The Dynamic Iridology Assessment System is the only live, online, fully mentored course for nutritionists, herbalists, and naturopaths, anyone who's got a college-level anatomy and physiology course already under their belt. That is a prerequisite to come into my course. When you've got that, we can go so much deeper. Without that, we're just learning one marking is one problem. And that's not useful for anyone who wants to practice as a clinical iridologist. And we do this because you don't want to spend a lot of time developing client programs. You want to figure it out quickly so that you're not spending time outside of client sessions creating programs. If you spend time outside of your client session creating a program, I guarantee you it's more information than your client needs. You're going to overwhelm them. They're going to have a hard time sticking with it. They're not going to be compliant. If you can create a succinct program while you are with your client will be more compliant. They will get better results. They will want to come back to find out what is the next step, and they will start doing your word of mouth advertising for you. So if you've got that college level anatomy and physiology course, and you want to learn iridology and sclerology at a professional level, and you want to learn how the markers play off each other, and you want to learn what questions the eyes want you to ask, and you want to learn how to create programs your clients can be more successful implementing, and you want to be mentored for the long term, and I mean years, not just when you're enrolled in the program. We've all taken courses where when the course is over, the door slams shut and you're on your own. I don't do that to my students. Then you want, oh, I thought I fixed this slide. Ignore this down here. You want to know, and you want to know what's included in the course so you can make an informed decision. Then I am going to give you a better link than the one you see on your computer screen. Okay, just let me double check this to make sure there's no typos. Oops, typo. Okay, there we go. There we go. Post that. So in the chat box, I've posted a link. This is where you can go to schedule a time to chat with me one-on-one, where we can talk about where you're at, what your goals are, and you'll be able, then we can decide, is this actually a good fit for you or not, right? Good. It's a really important thing to do. Jack says, I so appreciate all the extra support you give and willingness to answer any questions I may have. Oh, Jack, that warms my heart. I really appreciate you saying that. Thank you so much. So, so the next course starts on June 27th. There is the correct link again, iridology.education/course-info. Grab that out of your chat box and schedule an appointment. It's a no pressure call, right? It's an opportunity to talk with me. Again, figure out, is this really the right fit for you? If it's the right fit, I'll invite you to enroll. If it's not the right fit, I will suggest something in a different direction for you. Let's do another case study here. This is MG. She has been a client of mine for about 30 years. And as always happens, clients come in for a few appointments, they get feeling really good, they disappear for a while, 4 or 5 years later, they're getting older, they've forgotten everything I taught them, starting to fall apart, right? They come back in, we work for a few more sessions, get them back on track. So they ebb and they flow, and that's just the dance that happens. So on her most recent return to me a couple of years ago, she came in because she was gaining weight and she didn't want to. Again, she's in her mid-50s, she's got 2 kids, an 18-year-old and a 21-year-old, both boys living at home with her. She's divorced, and the boys, one is in school part-time, the other works part-time, but she works full-time to keep the show on the road. So as we look at her eyes, first thing we're going to notice is she's got the corneal annulus, right? So we know right off the bat that her liver doesn't handle its carbs well and has not been doing that for a very long time. We also know her liver wants to be cranky. The structure of her eye is connective tissue. And when we look at where she's got lacuna placed, she's got many instances of lacunae of different sorts in pancreatic reaction fields, right? So we've got pancreas, we've got liver sending the carbs into either triglycerides or cholesterol or insulin resistance kinds of things. So we look at her left sclera. We see we've got a bit of a tangential. We've got what could be the beginning of a fermentation sign. We've got a partial encapsulation, right? I'm making you think here as to what we've already learned today, right? And so we're seeing those things and we're going, okay, what does that have to do with weight issues? Okay. Then we look at her right sclera. Oh my goodness, we have got all of these fermentation signs. We've got a meander, which we learned a little bit about today, coming straight up into the kidneys, to the kidney zone. Got a little bit of the yellowing in here. Is that the beginning of maybe pinguecula? Very likely, along with a meander here, pointing straight in at the lateral heart zone. Okay. Her main concern, remember, was weight gain, right? Lots of information here. Not everything that I've mentioned is important to weight gain. So I'm focusing on this, and the fact that being connective tissue, her particular brand of connective tissue, she's got pancreatic syndrome happening, right? That's her genetics of how she was put together. So and her waist was definitely more than 36 inches. So that's your first suggestion that she's probably insulin resistant, right? So as we're talking, I've got her photos and I know her really well, so I can be pretty blunt, right? So I say to her, hey, MG, when I see this, it tells me that you are likely headed towards insulin resistance or type 2 diabetes. If you're not already there, you're headed in that direction. And when I see this and these, it just adds to that story. And she started crying. And I said, MG, tell me what's going on. And she said, my dad is diabetic, and I promised my boys I would never do that. So I said, well, you have control of this. I'm going to give you some things to start with, and you tell me what you're willing to do, and we're going to build this thing together, okay? She said, yep, okay. And so it was things like she was doing coffee for breakfast, coffee for lunch, right? Was throwing together something for supper. And so I said, well, first off, we need to get protein first thing in the morning. And that's that, and no coffee in the morning with that. We really just want good protein and some vegetables for breakfast. And I said, and that, because I know the stress you're under with work and with your two adult kids that are living at home, I said, that's all I want to do with you to start with. Let's just do that. Let's get you a little bit of digestive support, because I can see that protein might be a little harder for you to digest, and we need to digest as well to get us where we want to go. And let's get you replacing the coffee with water. Do you think you can do that? And she was pretty sure she could. So that was all I sent her out the door with the first appointment, right? And then when she came back again, we were able to build on that again. And we've continued to build. And as we've been building step by step, the weight is coming off. She's feeling more energized. She's feeling less stressed because things are working well for her. And so with that, my friends, that is what I've got for you today. Any final questions? So you now know at a surface level, 3 sclera markings. You see how sclera, which is very dynamic, interacts with iris, which is genetically determined. And you saw a little bit about the kinds of questions it could make you want to ask and the kinds of recommendations you could make and how to keep your programs laser focused. That is exactly the type of stuff I teach, plus so much more in dynamic iridology. All righty. I'm not seeing any other questions or comments come in. Again, if you've hung on to the very end and you're watching this on the replay, please remember to like and share and drop a comment. Is there a framed meander, and does it carry more significance? Framed meanders do carry more significance, and I didn't notice one, but I wasn't looking for that because it wasn't relevant to her, to the last situation, at least with MG. Jack says, thanks again for all your teaching. Amanda says, I feel so lucky to be here. I'm inspired. Thank you. Carmela says, thank you so much. Love this. I will reach out soon. I'm an acupuncturist in Northern California. Graham says, thank you. So good. So good. And you've all got the link in the chat box there. The replay will be sent out to those of you who are here and those who registered but weren't able to make it. It will go out to you tomorrow. Have a brilliant evening. And thank you so much for being with me today. And Lori says, thank you, Judith. You are so patient. Lori, I just love teaching. I love seeing the light bulbs go off in my students' head. I love those aha moments of, I get it. So so if that's patience, then that's good. Shona says, thank you. I hope I'm saying your name right. And I look forward to speaking with many of you, hopefully in the next week or two, to talk about the June 27th start date. Have a brilliant evening. Bye for now.